Runners, do you feel pain that goes from your lower back, wraps around the side of your hip, even down to the bony point of your hip? Many runners will be told that they have a low back disc injury or a joint out of place, but this could be a sneaky muscle called the quadratus lumborum, also known as the QL. This muscle creates a referred pain pattern which oftentimes confuses a lot of people, creating slow results and loss of mileage. This is a chart of referred pain. You can see this little X's here on the muscle called the quadratus lumborum, which attaches from the lowest rib, from the transverse processes of the bones of the spine here, and along the top crest of the hip. It is actually just behind the hip flexor or psoas muscle, which attaches kind of into the same area as well. You can see the red areas on this picture. The hot red areas are areas that people commonly complain about, while in the faint red areas, less people have complaints in those spots, but it's still possible. Notice that the deep aching in the lower back here, off to the right side in this scenario, creates pain along the spine, which can simulate low back disc injuries. It can simulate pinched nerves, sciatica, or even joint issues into the facet joints here. A lot of times people wake up with stiffness in the lower back in this area, which could be this muscle. It oftentimes gets worse with sitting as well as running. Notice that pain actually wraps around the front outer part of the hip, which seems like an outer glute issue. Some people confuse this with IT band issues, but IT band truly goes down the whole side of the thigh. But notice that there's an area right around the lower part of the lateral thigh, which can be confused as trochanteric bursitis. This oftentimes feels like you can't lay on this side comfortably when you're sleeping, and oftentimes stretching or challenging the right hip or right leg in exercises or weight bearing creates more of the problem. One of my recent telehealth sessions said that they had an x-ray done of their back and an MRI, and it said it looked completely fine. So this is possibly on the board for them. The reason is because the QL muscle, if not actually torn, which is rarely the case, a strain or overactivity is not seen on x-ray, and it's not seen on MRI either, because the injury doesn't create tissue disruption, and x-rays don't actually show muscles anyways. Now the QL muscle has a job, and it's very good at that job, and it's creating stiffness of the spine so you don't deviate too much as you walk, run, and even lift weights. Now, when it's good at spinal stability, it's really good at it, but it's not good at doing the job of other muscles which also have jobs to do too. The remainder of the core, if not working well, or deep core support such as internal pressure, if these are lacking, the QL takes over and becomes hyperactive, creating a referral pattern as we once saw. We oftentimes find it with those individuals who have hip drop when running as well, meaning it has to constantly contract to hike the hip up when usually other muscles help out with that process as well. Now I'm going to cover just a few of my favorite ones in this video, but remember, full length one is in the corner. Now there's a few things that we can do with our QL, and the first thing, since it is overactive on a lot of people, most of the time if we give it a break, we can actually help out quite a bit. So I'm going to get muffled because I know my microphone's on my shirt, so I'll show you a few different angles. But normally we're going to be head and hands like so. I'll be up just because of the mic. And then we're going to relax the back in a rounded position. Some people have a really hard time relaxing in this, so you can sit the hips back and let it round and just relax. And then you would take the hand on the involved QL side, and you would reach across the body and just hang out forehead on the ground. Okay? From the front angle, it's going to look like so. And then all you do is just breathe into that area as well. Normally doing it for about 30 to 45 seconds is sufficient. Now something else we can do is something called a side plank. Side plank is a progression. It's a harder exercise to do for some people, but some people it's really easy to do. Now the reason why we're choosing it here is because the QL, yes, it is working in this, but if we do it really well, we're actually encouraging the remainder of the obliques to help in the process too. So we're going to press and push the floor away with our elbow, creating the remainder of the stability here, holding for about 10 seconds and then coming down. So if your lower back, the side of your hip, the groin, and even lower abdominal area is bothering you and it's not really making any sense to anybody, we can help you out with this, and we should consider the QL muscle. There are ways to screen it out on even telehealth and see if it's a part of your problem, which we can find some easy wins for. If this video gave you an aha moment, we'd love a thanks. Go scroll down in the bottom part of this video on YouTube and look for the thanks button. It helps keep the lights on, it buys us a cup of coffee. Check in the corner for another related video on this topic.